Welcome to the PinkpillRx podcast, hosted by Katie and Jay Fillmore, where we navigate complex and thought-provoking topics surrounding women with a focus on education. For shorter form content, follow us on TikTok, Instagram, or YouTube at Caters88 or PinkpillRx.
That's Kators 88.
If you enjoy this podcast, please give us a follow and maybe a nice review.
As per usual, I want to remind our listeners that you can find us on not just TikTok, but also YouTube and Instagram.
Instagram.
And also, if you're interested in supporting us monetarily speaking, you can join our Patreon for just $1 a month. It helps us continue doing the work that we are doing. And if you have any stories that you want to share, please feel free to email them at pinkpillrx@gmail.com. All stories will be shared anonymously unless you specifically ask for your name to be included. And I do appreciate everyone who has shared a story. Even if we don't share it on our podcast, it's not because your story is not important or valid. Just know that I read every story. I might not always have time to reply to every story, but I do read every story. And I hold what you share with us very dearly and want to respect that. So just know that if you have submitted a story and not heard anything, it's not because your story is not valid and very important.
This woman reads every story, every single one of them.
I do read every story. As a reminder, we're your hosts, Katie
And Jay
Fillmore.
I love my favorite type of episode to go into is to go into it blind. I love going in blind, and I have no idea what we're talking about today.
Okay, well, today we are talking about something that you actually have experience in.
Okay.
We are going to talk about birth trauma.
Right.
Not as fun of an episode now, is it for you?
No, it's not.
But birth trauma is a big problem, especially in the United States, particularly in the United States, where many women report feeling that they have been traumatized by their birth. And when we talk about birth trauma, let's just define that real quick first. We're referring to physical or psychological harm experienced during or after childbirth. It can affect both the birthing parents and the baby. You can have physical birth trauma, and we're talking about physical birth trauma. We're talking about injuries such as tears, pelvic floor damage, nerve injuries, complications like postpartum hemorrhage. For infants, it might involve fractures or nerve damage, brain injuries caused by mechanical forces during delivery, things like that. Then we also are talking about psychological birth trauma when we talk about birth trauma, and that is involving emotional distress resulting from a traumatic birth experience, such as fear of injury or death, lack of control, feeling unsupported. And this can lead to conditions, both these things can lead to conditions like postpartum PTSD or anxiety. Birth trauma can result from factors like emergency interventions, prolonged labor, inadequate care during delivery. It encompasses like a wide range of experiences and outcomes, and it is on a spectrum. You know, some people obviously have more than other people, but in general, up to 45% of new mothers have reported experiencing birth trauma.
That is shockingly high, 45%. Whoa. Hasn't our, I don't know if it's mother or fetal mortality rate, isn't it awful for the developed world?
It is awful, and we will be talking about that.
Okay.
Because I do think that does play into this. I mean, we are not getting the care, and that is multi-layered. That is complicated. I am not putting this on one specific person. It is our healthcare system.
Man, 45% though. That is incredibly high, like half. It is essentially half.
There's this weird thing that when you experience birth trauma, and as long as your baby is healthy and you're alive, you should be happy.
Right, you should be grateful.
You should be grateful. What do you mean you have trauma? What do you mean that, you had a healthy baby? So I'm going to share my story real quick because that's definitely the vibe that I got in my story.
Yeah. It's interesting the bar is set so low that if you survive and your child survives and there's not like lasting physical or brain damage, you should just be grateful.
Right.
We just say you should be grateful to be alive.
Gosh, we are not trauma informed at all.
There's a place for gratefulness and to feel thankful and grateful. But it doesn't mean you can't also hold in the other hand grief and pain and things you need to recover from,
Yeah.
It's not one or the other. I think healthily, you hold on to both and you experience both and you process both. And because if you just have grief without gratefulness, it's probably feels very, 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 very dark, and maybe you lose sight of some of the things that are positive. I cannot speak to obviously birth trauma because I'm a man. But then if you just have gratefulness and you don't hold on, you don't allow, no one gives you the space to process your grief and your hardship, then it's like everything, it's just kind of hollow.
Yeah. Well, we're part of that statistic. We're part of that 45%.
Yeah. Go into your experience.
Yeah. So I had 3 very great births, very uneventful births. Everything went as planned. On my 4th birth, I was going to attempt a home birth with a certified nurse midwife. In Illinois, in order for a home birth to be legal, it has to be attended by a certified nurse midwife that is overseen by an OB, and my midwife was. So one of my biggest fears about a home birth, and I've had one before. I had one with our 3rd, went uneventfully, was wonderful. That's why I wanted to do it again with our 4th. But one of my biggest fears, and I had this all through my 3rd pregnancy, was what happens if there's a cord prolapse, which a cord prolapse is when the umbilical cord comes out first before the baby comes out. Often happens when your water breaks initially, that maybe the baby's not in quite the best position and that cord slips through. This is much higher risk when the baby's in a position like a breached position or something. Or if you have lots of water and your water breaks, that baby cannot be low enough in the pelvis that cord slips in front and kind of slips through. That when that happens, when that has happened, I've worked in the hospital. I used to work in the OB department. I was on the postpartum side, but I have seen the aftermath of this, and I've also seen it happen when it's gone down, when there's a cord prolapse. It is an emergency. Like, you need to be in the operating room yesterday, because that cord, once it hits room temperature, it will start to contract because it thinks it's born. And also the pressure from other baby parts pushing down on the birth canal cuts off oxygen to the baby. So you end up having high incidences of brain damage and hypoxia and babies just not doing well after a cord prolapse. So it is an emergency. And usually it involves a nurse sticking their hand up your vagina, pushing whatever the presenting part is way up, back up inside of you without squishing the cord, because you don't want to squish it even more, until they can cut that baby out of you. That's what that looks like. And they're up there on that stretcher with you, or up there on that hospital bed with you with their hand up in you. So that was my biggest fear, because I know in the hospital that doesn't turn out the greatest. And so when I asked my midwife that, she told me what we would do if that happened at home. But basically also told me, if that happens at home, the outcome's not going to be great. It's an extremely rare thing that happens. It happens in like 1% of births. So it's very, very rare. Fast forward, labor hasn't started yet. Guess what? My water breaks at home. I go to the bathroom after my water breaks. I feel something down there. I go to feel around. It's a cord. I know exactly what's happening, and I basically know that I am going to be planning my daughter's funeral, because I am at home and I have had a cord prolapse. My midwife isn't here because my water just broke at home. I wasn't in labor. I wouldn't have been in the hospital anyways. So I did what my midwife told me to do, and I went head first over my bed. I did a headstand over my bed with my hands on the ground. We called 911. They came. They kept trying to get me to lay on my back, but my midwife, I remember what she said, we don't lay on the back. So I'm like, I cannot lay on my back. I need my butt in the air, and someone needs to stick their hand up there. And so they were respectful of me. They listened to me, and they got me to the hospital, and I had an emergency C-section when I got there. I had no idea the lasting effects and impacts that was going to have on me. I mean, you hear about birth trauma, but the PTSD that happened to me after this, every time I went to the bathroom, was insane. The flashbacks, and it was mind-blowing. And in the meantime, you're being traumatized, Jay, because you can say a little bit about that.
Yeah, I wasn't well educated, and so our daughter, she a couple weeks before was in a breech position, but then she had moved back into the head down position, so we weren't worried about it. But when I found out that it seems like she may be in the wrong position again, and there's a cord prolapse, in my mind, being not really well informed, I thought that her life was in danger, and I also thought your life was too.
Right.
And no, I don't think anybody knew that I was thinking that. So like none of the paramedics or those working at the hospital or those who like were family members that were with me while you were back in getting your emergency C-section, like I am crying thinking that your life is in danger. And I'm holding your wedding ring and I'm holding your glasses because you're back there in surgery. And it was scary on a different level. I was scared for our daughter, but I was more scared thinking that I was going to lose you that day. And I struggled with PTSD flashbacks for like a year and a half. Like I couldn't watch anything birth related on a show or in a movie or people talking about it. If I saw an ambulance driving down the main road that's near our neighborhood, like I would start crying.
Yeah.
Like I couldn't handle it.
So here you are with your own trauma, trying to take care of me with my own trauma.
Yeah.
Luckily, baby was born. Baby has no deficits. Baby was fine. And I do attribute home birth to saving my life or saving her life, because I would have had no idea what to do had I not had that intuition, that fear, that worry that I talked through so thoroughly with my midwife beforehand, because I just would never have probably thought about it. I wasn't planning on my water breaking before labor started, you know. I would have just probably gotten in my car and gone to the hospital, and she would have, by the time we got to the hospital and by the time that they cut me open, her heart rate was 58. So if you know anything about babies, newborn babies, 58 heart rate, that you can't survive that long. We're talking like a couple minutes before permanent damage is done.
And it's interesting is like that they took that reading after they made you get on your back at the hospital.
Yes, they did make me get on my back to examine, and I did fight them, and they were fighting me about it.
Yeah,
but
you were not on your back in the ambulance.
No.
And you having the knowledge to make sure that you were not on your back, I think kept her heart rate up in transit.
Part of my point in sharing that story is that the attitude that the whole hospital had towards me, and even some family members had towards me, was you should just be so grateful. Even though like this was a really traumatic thing that happened. And like it almost like felt like there was no space for my feelings about the fact that my world just turned upside down, and I just had an emergency C-section, and I just had this, like, I was, when they were putting me out under general anesthesia, this is how emergent it was. I woke up in my street clothes still. When I was going to sleep from general anesthesia, I'm just thinking I'm going to wake up and I have to plan a funeral. Like that's my mind space. That's where my brain is at. That was real to me. And that is real to so many women who have emergency C-sections, or when things start to go south. That is real. Your brain has gone there. That there's trauma there when you believe that your baby is dying, or you believe that you are dying, even if it doesn't happen.
Mm-hmm. Your body's experiencing all those things.
Yeah.
All those emotions that you're having, and all the fear, and it's all the realness.
So we have 45% of new mothers that report experiencing some kind of birth trauma. But in the United States in general, approximately 5 to 6% of women develop full post-traumatic stress disorder following childbirth.
Whoa.
However, if you're in a high-risk group, meaning you experienced an emergency C-section, severe complications, your baby ended up with a NICU stay or something like that, those PTSD rates rise to 15 to 20%. And we're not providing mental health care support for this. all the focus is on postpartum depression, which is a good focus, but and birth trauma can lead to postpartum depression. But we've got other things that are going on here too that we need to take into consideration. Additionally, 9.6 to 27% of women report clinically significant PTSD symptoms without meaningful diagnostic criteria. So these women who have given birth, just in general, women who have given birth, up to 27% report PTSD-like symptoms, even if they do not meet full diagnostic criteria.
Does that include those who officially meet the criteria, or is this those who don't meet the criteria but still have the symptoms?
They don't meet the criteria, but they still have the symptoms.
So this is on top of the other percents you just gave?
Yes.
Oh.
We're not okay.
Wow, that's really alarming. That's really alarming. Everybody should be very concerned about that. Men and women.
There was one study that they did where 46% of participants reported feeling tense or anxious when reminded of the birth, and 38% experienced distress when reminded of it. 31% experienced flashbacks, reported experiencing symptoms like flashbacks. 17 to 30% experienced avoidance behaviors, and negative cognitions were also very common. So negative feelings towards the birth. I never hear this talked about. And so these percentages are alarmingly high because to me, someone who's not in the medical world, just think, oh, what I hear about childbirth is the Facebook pictures, all the babies here. And the announcements that are given, so-and-so's born at this time and this weight and stuff like that. It's not really a public correct me if I'm wrong, but it's not really a public conversation. It's not. And you got about half of women that are dealing with this. So about half those fun pictures you're seeing, there's a big story behind it.
I had no idea. That's alarmingly high and it's heartbreakingly high.
Approximately 6% of fathers report symptoms consistent with probable PTSD following childbirth.
Oh, well, I'm in there.
And this figure comes from a study examining PTSD symptoms and fear of childbirth in fathers during the first year after the child's birth. This research also indicated that 1 in 10 fathers, or about 10%, experience postpartum depression or anxiety during pregnancy or within the first year following birth.
Oh, I had anxiety every time one of our kids was sick that wasn't just a traditional cold or something. You remember that?
Yeah.
I was afraid of our kids dying. I would sob when they would get sick.
While the father stuff that I just said isn't explicitly labeled as birth trauma, it obviously suggests that there's a significant psychological distress related to the birth experience that fathers are experiencing.
Yeah, well, you mean you worry about your partner?
Well, yeah, because it's different. It's different than what the woman's experiencing. Fathers are typically experiencing this feeling of helplessness while watching a potentially catastrophic situation unfold.
Yeah.
Fears about the death of their partner or child. Feeling abandoned or lacking information from medical staff.
Oh, yes.
Trying to keep it together despite intense emotional distress.
Yeah.
I mean, can you relate? I feel like you can relate to all of those.
Yeah, I can relate to all of those. And it is very different from your experience. And I don't want me talking about mine to somehow detract from yours or make some kind of comparison between the two, because I don't think there's any comparison between the two. It was your body and you were out of control of it. And something was happening to you physically. So yours was very, very different than mine, and I don't think they're really in the same league, but that doesn't mean that mine also wasn't very traumatizing,
Right. Something that's interesting about C-sections, because C-sections are a risk factor for birth trauma.
Sure.
Okay. Is that in the United States, approximately 32.4% of births are cesarean deliveries, which is significantly higher than the World Health Organization's recommended ideal rate of 10 to 15%. For optimal maternal and infant outcomes, that's what they say it should be. And studies suggest that about half of these C-sections that happen in the United States, up to 500,000 annually, may be unnecessary when compared to practices in other countries with lower rates.
So then why are they done?
This indicates that a substantial portion of U.S. C-sections could be avoided with better adherence to evidence-based guidelines and fewer non-medical factors influencing decisions.
What factors that are non-medical, do you think?
A lot of C-sections happen around 5 p.m. in the evening.
Are you serious? Are you serious?
Yes, I am serious. That's just one non-medical factor. That usually they'll let them trial labor, and then by the time 5 o'clock rolls around, it's statistically significant amount of them happen between 5 and 6 o'clock in the evening.
So would that, obviously this is conjecture, would that be indicative of, physicians are leaving for the day? You want to wrap this up?
Yeah, some would say that. I mean, I do believe in the place that I worked that sometimes there's a specific doctor I'm thinking of. Now, granted, if you're letting them trial labor since early in the morning, it's possible that this is the time that babies start to see a lot of, babies start to show a lot of distress and stuff.
Yeah.
But it is odd that babies start to show distress around 5 and 6 p.m.
Yeah.
Something I want to talk about, too, that isn't often talked about that has to do with birth trauma is miscarriage trauma. About 1 in 4 pregnancies end in miscarriage.
Didn't know that's really high.
It's high, yeah.
That's really high.
And usually, unless you have 3 in a row, they're not really concerned. You can have 2 in a row, and they still aren't going to do testing usually. But if you have 3 in a row, that's considered serial miscarriages. And then they'll do that. But approximately 25% of women experience PTSD symptoms 1 month after a miscarriage, with 6% still affected at 4 months.
So 25% of pregnancies end in miscarriage. And out of that 25%, 25% have PTSD 30 days out.
Yes. And another study showed that it was closer to 1 in 3 women that develop PTSD symptoms after miscarriage or ectopic pregnancy. Based on data, approximately 1 million miscarriages occur in the United States every year.
Okay. So then you take, because then you said 25% of those miscarriages, 30 days out, you have PTSD from it, right? You're looking at 250,000 women every year develop PTSD as a result of a miscarriage.
Yeah, and 6% of those are still affected at 4 months.
6% of those who had it at 30 days?
Yeah.
Okay, so then at 4 months, you're looking at about 18,000 women.
But this isn't a major mental health crisis. It should be.
Yeah, that's 18,000 like individuals that are just living among us most likely without support for this.
Women who have miscarriages often report dissatisfaction with the emotional support and communication provided during their loss. Many feel really dismissed or unsupported by healthcare providers, which leads to this feeling of isolation and trauma. I see that. I think that's so important. I hear that reported so often by clients of mine, that the way that they were treated in the hospital as if, well, it happens. Like this is just a medical event that you're experiencing.
Just a medical event.
That's how it's like treated as. And there's this like lack of clear communication a lot. Women will be given these phrases. One phrase that gets really confusing for women is they're told that they're having a threatened abortion, which can really mess up some women. Like, what do you mean? And really what they mean is a threatened miscarriage. Like they can't say for sure that you've miscarried, but it looks like you're heading that direction. But on the medical side of things, a miscarriage is called a spontaneous abortion.
Because the pregnancy is aborted.
Spontaneously aborted. Yes, exactly, by your body. So, but there's this lack of clear communication on what these phrases mean. And that can cause a lot of distress for women.
Yeah, sure.
They often have to also make decisions like quickly, like, oh, do you want to go in and have a D&C where they like go in and they like scrape your uterine lining and stuff to like get everything out so that you'll stop bleeding. Mm-hmm. But a lot of that is needing like that's like fast time decisions and stuff like that. Right. Sometimes it's emergent and like you really don't have a choice, but other times you do have a choice to like wait it out and do it more naturally and see if your body will take care of it on its own, or if you want to do the surgical route.
And are you getting painkillers? Are you getting anesthesia for that?
Oh, yeah. I mean, like for the DNC, you are.
Okay,
yes,
well, that's good.
You do. But if you're going to manage it at home, you're not. And it is a painful experience. Like, it is physically painful. You do go through like a miniature labor when you miscarry. It's not just a period. And there's just like this lack of validation and emotional support and feeling seen that like this was not just a medical event for you.
Yeah. Yeah, medical event sounds very sterile.
And a lot of the, if we set aside emergency C-sections and like NICU stays and stuff like that with birth trauma, like it's a lot of these micro things that happen to women in birth that cause trauma, right? It's the unconsented to episiotomy. It's the feeling like you didn't have autonomy of choice. It's feeling forced into things. It's feeling like there wasn't clear communication about what was happening. It's everybody's hands all over your body. It's the repetitive cervical checks, especially if you've had any previous trauma, like sexual trauma or anything like that. Like, that is really triggering. So it all adds up. And I think it's due often to a broken healthcare system. I don't blame exclusively doctors or nurses or hospitals or anything like that. I blame the broken healthcare system. I mean, the healthcare system for maternal health is even worse than just like the normal healthcare system, I feel like, because our mortality rates are through the roof. So like Switzerland and Sweden respectively have 1 per 100,000 maternal deaths, and Sweden has 3 per 100,000. Canada has about 11 per 100,000, and the United Kingdom has about 10 per 100,000. Mm-hmm. You want to guess what the U.S. is per 100,000?
15.
18.6.
That is so high.
That's as of 2023.
Yeah. That's almost double Canada and the UK. And almost... I mean, that's crazy compared to Switzerland and Sweden.
Yeah, you want to guess what Black women's maternal mortality rate is?
Oh.
Let me tell you what white women's is.
Okay.
14.5.
Okay.
That's white women.
Then I'm going to guess, because that's 4 below the 18%. I'm going to guess, let's 25%, 22 to 25%.
50.3.
Whoa. That is insane. 50?
Compared to 14.5 for white women.
That's almost 4 times.
Yeah.
And why is that? Why is that?
Well, personally, I think it's because of systemic racism within the medical community.
Like procedures and practices that are just kind of tailor-made for the white archetype? Health-wise and
not just that, but there's these stereotypes that like Black women will come in and they are complaining of pain or they are complaining of things and they are chalked up as to being dramatic.
Yeah, we've talked about that, yeah.
Or being angry.
And then they're just not listened to and they really needed something?
They really needed something. Dude. I mean, they are more prone to some like hypertension, like high blood pressure. They're more prone to that. Mm-hmm. But really, truly... 50, come on.
Yeah,
you're 3.5 times more likely, essentially.
Yeah, and you're going to say, well, they're more likely to have high blood pressure.
Yeah.
Okay, not that drastic of a difference, though.
There's issues to healthcare access, quality of care, socioeconomic conditions contribute, but they often receive lower quality of care and face implicit bias from healthcare providers and have limited access to healthcare resources. There's just a lack of culturally competent care. There's differences in patient-doctor communication, which we talked about with Mackenzie when she was on.
Yeah.
If you live in a rural area, that number goes up to 81.7.
Whoa.
Per 100,000 live births.
Right. Jeez. And then Switzerland's at 1.
Well, yeah, that's for all demographics, but yes, like combined, Yeah. But to put that also into perspective, like Hispanic women, 12.4, Asian women, 10.7 per 100,000.
Interesting.
So this 18 point something, like if we could just put so much focus on the care of Black women, we could really lower our overall maternal mortality rate.
What was the rate for white women?
14.5.
Interesting. But you're right. If you just focus on those that are obviously having the highest risk and just start with focusing on them.
Do you want to know where we rank with maternal mortality rate? In 2020, the World Health Organization put out a report with who ranks where. Where do you think the U.S. ranks?
I know it's not good. I've heard it before. I can't remember. I'm going to guess 27th.
Lower on the list.
35th.
Lower.
Dear God. 40.
Lower.
50.
Lower.
Are you serious?
Yes.
60.
55. The U.S. ranks 55th in the world for maternal mortality, according to a 2020 World Health Organization report. And that was out of 195 countries.
Oh my gosh.
Now, maternal mortality rates vary significantly state to state.
Oh, this will be interesting.
Mississippi in 2021 had the highest maternal mortality rate with 82.5 deaths per 100,000 births.
Do we know what is for black women in Mississippi?
I do not know what it's for black women. Okay. Followed by New Mexico at 79.5 deaths per. I mean, think about it, because the average is 18 points.
Yeah. So we probably have a lot of states that are just weighing us down.
Yeah, California had the lowest mortality rate of 9.7. But listen to this.
Okay.
So all these states, they report, right, your maternal mortality rates. They have maternal mortality review committees.
Okay.
Okay, which are a good thing.
Sounds like it.
Right? Okay. Well, Texas decided to forego federal funding and stop sharing maternal death data with the CDC. The state announced that it would not review data from 2022 and 2023. Instead, they did decide that they would report for 2024. But they're like basically deciding to forgo federal funding in lieu of having to report this stuff. Georgia disbanded its maternal mortality review committee in response to the publicization of 2 women's abortion-related deaths that were deemed preventable. So they just decided, we're just not even going to go over it. We're just not even going to go over it because we don't want that information out there, or we don't want to be subject to that.
Yeah. Yeah, well, it sounds like Texas is hiding something.
Yep. North Dakota's committee was formed in 2021, but it's never met to review cases. These changes in tracking and reporting maternal mortality rates are often linked to political decisions, particularly in states with strict abortion laws.
Oh. Why?
Because women are dying due to not having access to proper care. So, yeah, they just decide we don't need federal funding. His mouth is agape, folks. You'll be able to see it on TikTok eventually.
Let me just give me a second. So you're telling me women don't have access to terminate a pregnancy when they need it for health reasons. They die. The maternal mortality rate is much, much higher. And then they don't want to report their data?
That's the theory.
Wow.
Texas has a near total ban. It prohibits all abortions with exceptions only to save the life of the mother. However...
You got to prove that probably.
Thank you. Yes.
Yeah. So the burden of proof falls on... So you're having a health crisis and you need to abort your pregnancy because your life is in danger. But then on top of dealing with that, you have to deal with being a lawyer and basically having to prove it.
Yeah. And here's the thing is you could be hemorrhaging possibly or bleeding a lot, and your baby still technically has a heartbeat, so they cannot terminate that, and they will sometimes have to send you away until things get worse, and women have died from this. Women have gone septic from this. Because there are criminal penalties. Like, they will prosecute doctors if they think that they have performed an abortion past 6 weeks, because there's a 6-week ban.
Right, when women don't even know they're pregnant until sometimes many times 6 weeks or after, right? I mean, that's really freaking early.
According to NBC News, from 2019 to 2022, the rate of maternal mortality cases in Texas rose by 56%, compared with just 11% nationwide during the same time period. Did
Texas change abortion laws somewhere in the late 2010s 2010s, early 2020s. I'm sure in 2025 they did, or in 2024.
In 2021, the Heartbeat Act went into effect, which banned it at 6 weeks.
Okay.
Now, remember what I told you is they forewent reporting in 22 and 23.
Yeah. Right. The subsequent years following that.
Now, I will say this. The high maternal mortality rate in the United States in general isn't just due to what we just talked about.
Yeah.
We have chronic health conditions. Many women enter pregnancy with pre-existing conditions like obesity, hypertension, diabetes, things like that. We're just not a healthy nation. There's healthcare inequalities. We have a high, like we said, Black women really suffer in this. And so there's structural racism, implicit bias that plays into it, healthcare quality.
Private insurance.
Mm-hmm. Mental health and violence. We have spoken before about how women are killed often during pregnancy.
Mm-hmm.
And this happens often during postpartum. In 2022, it was, yes. In that Harvard study in 2022, homicide was the highest cause of death. And, with those C-sections, it's not just the C-section itself that's like traumatic, but there's surgical risks and complications afterwards. And the major cause of maternal mortality, both patients and providers often fail to recognize or act on warning signs of complications. Do you want to know how much percentage of these deaths have been deemed as something that could have been preventable? 84%. That something in the chain could have been prevented.
So our rate per 100,000 overall is 18, right?
Yeah.
So, but if 84% of that is avoidable, I'd probably bring our rate down to 3.
Yeah.
Whoa. There needs to be okay. There won't be, but there needs to be an overhaul on that, a bunch of studies done, a bunch of different laws and regulations changed or anybody in that chain,
Yeah. I mean, and our infant mortality rate isn't great either. In the United States, it was 5.6 per 1,000 births.
Whoa, okay.
In Finland, it's 1.7. Japan, it's 1.7. Estonia is 1.5. And in 2023, the United States ranked 54th in the world for infant mortality.
It's unacceptable. Both these are unacceptable.
Yeah. All of this requires systemic changes in healthcare delivery
and
expanded access to care. And also targeted efforts to reduce racial disparities. We got to do that. So yeah, that's what I got for you today. If you've suffered from birth trauma, you're seen. Just know that. If you've had a miscarriage and that was a huge struggle and is a huge struggle, you're seen. Just know that. We're not meant to just bury this stuff and just keep moving forward and keep moving forward and keep moving forward. Please get the help if you need the help. I think there needs to be routine screenings for this stuff. And it's beyond just the postpartum depression screening. Screenings to see if you have experienced birth trauma. Because something that I was able to do, because I had a very attuned midwife who knew where I was at mentally with my birth trauma, was we did something called a rebirth, where she came over and we basically reenacted to some extent kind of what I wanted my birth to have looked like. Now, this isn't having my baby come out of my vagina. That's not what I'm talking about. But it was bringing my birth team together. It was talking through the experience. It was talking about what I wish would have gone differently, how I pictured it originally going. It's taking pictures and just doing things like that in a very peaceful environment. So I was able to do that. And it was very healing, I felt like, for me. I don't know if it was healing for you, Jay, but I felt like for me it was healing to just be able to share the story, be seen, be witnessed, and go through some of these steps in reenacting what we wish could have happened.
I think there were elements of healing. For me, regarding our daughter, it didn't do anything, I don't think, for me regarding you.
Yeah.
Though.
Yeah. No, I could see that. I think some kind of service, some kind of support like that is needed for women who have experienced these horrible horrible things. So
Absolutely.
you are not alone. You are in well company. In fact, you are in company with almost half of women.
Yeah.
All these Instagram posts and all these picture perfect moments aren't really picture perfect. One out of two of them that you're going to see has a story behind it that is one that a mom is going to need to heal from.
Yeah. Man, that blows me away. I hope for those of you listening, something was intriguing or sparked a curiosity, or you felt affirmed or challenged. Stay educated. Take the pink pill. If you enjoyed this podcast, please give us a follow and maybe a nice review.